Hello, my name is Maria Tovar. My video is about asthma, the pathophysiology, prevention, treatment, monitoring the effectiveness of the treatment, and health promotion. In this video, you will learn about the terms triggers, inflammation process, airflow obstruction, asthma action plan, bronchodilators versus controller therapies, treatment effectiveness, and lifestyle changes. In the next two slides, we're going to talk about the pathophysiology of asthma. First, let's identify the triggers or the causes of asthma. Some of the known triggers for asthma are genes, diet, air pollution, allergens, exercise, infections, stress, and hormones. In this picture, you can see the lungs, and we are comparing two different types of airways. Here we have the normal airway, which is the lumen is open and the smooth muscle is not constricted. Whereas on this side, you have the inflamed airway, which you can see the constricted smooth muscle along with the edema in the lumen and the mucus. This is what happens in asthma, the bronchoconstriction, the narrowing of the lumen, and the mucus. This is the second slide that talks about the pathophysiology of asthma. We're going to be able to answer 6 questions of how asthma affects an individual. The first one is, who is affected by asthma? Well, it's a person with known or unknown trigger. What gets affected? The airway. When? Anytime a trigger initiates an inflammatory process. Where? Anywhere the trigger is found. How does asthma happen? First, the trigger activates the inflammatory process, calling cells and chemicals to the airway. This leads to excess cells. The excess cells decrease the lumen of the airway, causing waste and nutrients from excess cells. This causes edema, vasodilation, and mucus production. All of this edema and swelling of the lumen creates the bronchoconstriction, the edema, and also the mucus production, which ultimately leads to obstruction of the airflow. Why do people get affected or have asthma? And it is due to genetic or environmental factors. Now, if you're experiencing obstruction of the airflow, people show up with symptoms of shortness of breath, cough, wheezing, and they usually complain of chest tightness. Now we're going to discuss the prevention of asthma. First thing you have to do is identify the trigger. You can identify the trigger by performing a skin test. With the skin test, it lets you know what specific thing causes the asthma exacerbation. Once you know what causes or what triggers asthma, you're going to avoid it. If it's dust mites, you're going to do weekly washing of the blankets. If it's a pet like their hair, you're going to avoid pets. Or if you love pets or you already have a pet, make sure that the pet doesn't go into the room of the person that has asthma. Also, no mold and roaches in your home or building that you work or you're going to spend most of the time in. Smoking cessation or avoid smoke from barbecues or stuff that you burn. Flu vaccine. Get the flu vaccine. Use medication prior to exercise if you have exercise-induced asthma, and make sure you follow the asthma action plan. The asthma action plan is divided into 3 zones. We have the green zone, which is you don't have any symptoms. You follow the rapid relief medication. Now the yellow zone is your caution zone, and here you're going to add one medication or you're going to add a medication to the treatment plan. And in the danger zone, it's very important that the family, community, or people that you are around with know that this is a time that you need help to get to the doctor, because you are short of breath and you need prompt relief from this airflow obstruction. We're going to discuss true treatment plans for asthma. We have the first one, which is the bronchodilators, the rapid relief, and the second treatment is controller therapies, which includes your inhaled corticosteroids, which is the most effective. Continue with the treatment and discussion of the bronchodilators. We're going to talk about the beta-2 agonist, which the reason they are prescribed is because they relax the smooth muscle, decrease contraction, inhibit mast cell release, decrease mucus exudate, decrease sensory nerve activation. There's two types of beta-2 agonists. We have the SABAs versus the LABAs. The SABAs are the short-acting beta-2 agonists. This includes albuterol, terbutaline. You can use them as needed. And if you have exercise-induced asthma, they come in an inhaler or nebulizer form. Then you have the LABAs, which are the long-acting beta-2 agonists. This is used salmeterol and formoterol. You can use this one every 12 hours. And last, we have indacaterol, which is every 24 hours. Some of the side effects from the beta-2 agonists are palpitation, muscle tremors, and decreased potassium in the serum. Continuing with the bronchodilators treatment, we have the anticholinergics, which they prevent bronchoconstriction, decrease secretion, used when inhaled corticosteroids and LABAs not effective. So this is the addition to the treatment. Some of the side effects from anticholinergics are the dry mouth, urinary retention, and glaucoma. These side effects are mainly seen in the elderly population. Now, the last one is theophylline. Theophylline relaxes the smooth muscle, decreases phosphodiesterase, and it's an anti-inflammatory. Some of the side effects from theophylline are nausea, vomiting, headache, diuresis, palpitations, arrhythmia, seizure, and death. Now we're going to talk about treatment, the controller therapies, inhaled corticosteroids. What do this medication do? They are anti-inflammatory. They help switch off the inflammatory response, decrease eosinophils, T lymphocytes, mast cells, and sputum. Some of the side effects from the controller therapies include hoarseness and candidiasis. Continuing with controller therapies, we're going to discuss the medication that is used in severe acute asthma, which is systematic corticosteroids, which includes the hydrocortisone and methylprednisolone. Some of the possible side effects from systematic corticosteroids are depression, cataracts, hypertension, myopathy, gastric ulceration, truncal obesity, diabetes, bruising, and osteoporosis. Now, the medication that can be used with patients who are possibly non-compliant is anti-leukotrienes. Possible side effects from the medication is myopathies. Last medication that is used with children or for short duration is cromones. Some of the side effects from the cromones are diarrhea and headache. Monitoring the effectiveness of the treatment through 10 steps. The first one is patient uses medication correctly. Second, minimal or no chronic symptoms like shortness of breath, wheezing, cough, or chest tightness. Patient does not wake up at night with symptoms of asthma. Fourth, minimal exacerbations or no exacerbations. 5, no ER visit. 6, minimal use of beta-2 agonist, the rapid relief inhaler. 7, no limitations on activity. 8, peak expiratory flow circadian variation less than 20%. 9, normal peak expiratory flow. 10, minimal side effects or no side effects from the medication. Health promotion to prevent asthma or control asthma through lifestyle changes. Participate in Asthma Awareness Day. Know written action plans and implement them. Family, work, school need to know how to help a patient who has asthma. Teach the patient about spirometry and peak expiratory flow. In this picture, we see a patient performing a spirometry test. Patients need to know what level they are and for comparisons. Correct use of medications. Advocate for healthier air. And last, work for housing regulations that will get rid of mold, roaches, and dust mites. Last, this is a summary of the asthma video. Asthma is an inflammation of the airway that decreases airflow. Control asthma with an action plan and remove the trigger. Correctly use bronchodilators and inhale corticosteroids. Report frequency and intensity of asthma symptoms. Report side effects from medications. Learn about asthma and teach the family and the community how to help. This is the end. Thank you for watching the video about asthma.